The BMA asked members to send in their questions for the Chairman of BMA Council, Dr Hamish Meldrum. Many of them had themes in common, and we will now put them to Dr Meldrum. What do you see as being the main challenge for the profession in the next year, Dr Meldrum?
Gosh, there are probably so many, it's quite difficult to narrow it down to one when one thinks of getting MMC delivered this year, getting the SAS contract out, trying to get a fair deal given the recent DDRB report on pay for junior doctors and GPs and such like, threat of GMC changes, lots and lots of things. I could go on forever. But I suppose a lot of them come under the heading of what doctors feel is an attack on their professionalism. And that brings us into what the role of the doctor is. I think doctors feel that so much of their work now is being micromanaged by managers and politicians, and they're not actually being allowed to get on with the job that they're trained to do.
And what does the BMA plan to do about this?
Well, we're taking forward quite a bit on the work of the role of the doctor, which we feel is so important, not only for deciding how we should train doctors in the future, but actually making sure that their professionalism is respected. Of course there are parts of a doctor's job that other people can do, but equally there are some skills, attributes, qualities that only doctors bring to the job, and we need to value them much more than we're doing at the moment.
And talking about valuing doctors, the recent DDRB pay award, if we can call it that, what do you feel about that?
Well, it's a disgrace, really. There are so many aspects of it. The overall rise is barely enough to cope with inflation, but within it there are specific areas that we have real concerns about. The lack of recognition for the removal of free accommodation for junior doctors, which means that effectively they could be about £5,000 a year worse off after tax. The fact that the way they have paid the fairly miserly increased GPs means that the vast majority of GPs will see nothing at all for the third year running, which effectively for them, given the expenses they've got to pay, is yet another pay cut. It just sort of adds to what people see as the erosion of any of the good work that we've done for these groups over the past few years.
And you said early on that it was just about enough to cope with the rise in inflation, but indeed that might not be the case even.
No, well, of course it depends which inflation marker you use, and the government's very keen to use the one that benefits them most. But by common consent, inflation may rise 3 or 4% over the next year, and therefore 2.2% is effectively a pay cut.
Indeed. Moving on to GPs, many of them will have to compete with commercial providers for NHS funding to provide services. How will the BMA support and work for GPs in this aim?
Well, there are two main tracks. I mean, first of all, we have conference policy to try and oppose the march of the private sector in the NHS, and we're doing all that we can to try to achieve that. But at the same time, you're right, we do have to give GPs the wherewithal to compete, and in terms of how to bid for contracts, how to set up companies to take part, how to protect the employment status of GPs who are employed by private companies. All these issues we've been producing guidance and giving support to GPs who request it.
And consultants, another major branch of practice, of course. The BMA is about to campaign for a consultant expansion. Why do we need more consultants in the NHS?
Well, part of the reason for our campaign is we've taken evidence from the colleges, and in many specialties, emergency medicine, trauma, paediatrics, obs and gynae, there's a clear under-provision of consultants. Given too that with the increased number of medical students, we've got more students coming through the training system, and given that there's very good evidence that a consultant-led and delivered system is a very effective, not only clinically but cost-effective way, then there seems to us the argument is absolutely clear that one of the ways to answer the problems of increasing number of medical students and answer the problems of some of the deficiencies in the healthcare system is to have more consultants.
Obviously more jobs for junior doctors in the future. But talking of juniors, what's the BMA doing to make sure there's no repeat of last year's MTAS disaster?
Well, you say no repeat, and I repeat my apology to junior doctors for the dreadful situation they found themselves in last year. It was indefensible, and we've done a huge amount of work in the last few months to try and make sure we don't get a repeat. We've been very active in what's called the Programme Board, which is looking at this year's implementation of MMC. We've got rid of the national computer system, which failed so miserably and caused many problems. We've pushed and had some success in increasing the number of training places at various places in the programme. We've tried to campaign to get a fair situation for international medical graduates who want to compete as well. And of course, over and above that, we've been very much involved in the TOOC review, looking at the longer term ways of improving junior doctor training.
Do you think it's going to be easier this summer?
I would never want to be complacent. The signs are slightly encouraging that we're not going to have the massive problems we had last year, but we've still got a situation where we've got far more doctors competing for training posts than are available.
Of course, there's another problem for juniors, the decision to remove free foundation year accommodation. Is the BMA doing anything about that government decision?
Well, it was actually a decision by the review body, and we find it appalling. Of course, they were probably put up to it by government. For years, government had been saying that one of the reasons that junior doctor pay, house officer pay, foundation year 1 pay can be as low as it is because of the benefit in kind of free accommodation. Now that that's been removed, there seems to us no argument for trying to sort out the problem that junior doctors will be thousands of pounds out of pocket. We're looking at what we can do either by direct negotiation with employers. We're considering how we can highlight the problem, whether we have a day of protest, a day of action. A whole lot of issues are being considered by the BMA and the Junior Doctors Committee, and we won't rest until we get this problem sorted out.
So watch this space for that.
Absolutely.
Moving on to this staff and associate specialist group of members, a very important group of members who have opted for the new contract now. How is the association, the BMA, ensuring that the new SAS contract is implemented?
Well, the contract, of course, is voluntary. It's only for those who want to take it on. And we've already been writing to SAS doctors to tell them what they should be doing about keeping a diary of their work, looking at how they're going to judge what their contract should be. We've been briefing and educating our regional services members so that they can advise our SAS colleagues on exactly the work they should be doing, help them with negotiations with their trusts, because much of the implementation will be local. But over and above that, on a more national basis, we're seeking to take forward a lot of the things that were mentioned in Choice and Opportunity about improving the status of SAS doctors, which have not really been considered at all in the contract negotiations, and which also take into account the idea that John Tooke said about destigmatising the whole grade and making it actually much more realistic that doctors can move from that grade into consultant grades in the future.
And finally, Dr. Meldrum, you're coming to the end of your first year as chairman. How's it been?
Well, as I always thought it would be, a sort of fairly exciting, nail-biting roller coaster. It has its highs and lows. But as somebody who enjoys facing challenges, I certainly had plenty of them to face. How I've done is for others to judge, but I'll continue to put every ounce of effort I can into representing a profession I'm very proud and privileged to be leading.
Thank you, Dr. Meldrum.